there's two studies that caught my eye. I just wanted to get your comment on it. So there's two studies that were published in 2017 and 2018. Both were published by the University of Toronto. And they were published in partnership with Harvard University, University of Michigan, Indiana University. They were sponsored by, I think it's the National Institute of Health. And what they found in both of those studies is that there was an association between exposure to fluoride in pregnant women and elevated incidences of ADHD and lower IQ among their children. And what was really remarkable about this study is that they actually followed 213 mother-child pairs from pregnancy, and they tested the children, for example, at age 2, at age 4, at age 6, at age 10. So this was a longitudinal study. And the findings, and I'm trying to quote here from one of the lead authors, the conclusion was, our findings are consistent with a growing body of evidence suggesting that the growing fetal nervous system may be negatively affected by higher levels of fluoride exposure. They're not saying this is fact. They're not saying that they're not making an absolute conclusion, but what they're saying is we need to investigate this more. There's enough grounds, the methodology seems to be fairly solid. There's enough grounds here that we need to do a little bit more research. Can you comment on that, on those two studies?
Sure. As I mentioned, this document is recently prepared by Public Health Ontario, our scientific body, and it touches on specifically on those studies. And I would just say that the studies, and I'm quoting verbatim, these studies were critiqued by other researchers for methodological limitations, including measurement error and no consideration for other potential explanatory variables such as preterm birth, exposure to tobacco, alcohol, arsenic, or lead, apart from socioeconomic status. The results are advised to be interpreted with great caution due to the high risk of ecological fallacy. Water fluoridation is measured at the state level, and confounding biases. And as you know, Councillor, anytime when we are looking at any study, confounding and bias is one of the most important things that we have to look to make any kind of meaningful conclusion. And based on the methodology, if those questions are raised, it raises doubt in terms of what the conclusions, how the conclusions are being drawn, and whether it can be applicable to other communities or other individuals. This refer back to this paper. this conclude that there is nothing to say that it caused any concerns in the neurodevelopment or ADHD. And this is also proven by the European Union for Scientific Community and Health Research. They also said exactly the same thing, that there are fluoride in drinking water at levels permitted does not impair children's neurodevelopment. To have those recommendations right in those documents.
No, absolutely, and we know association does not mean causation.
Exactly.
And the researchers themselves, they don't purport to state that it causes or that this is conclusive or whatnot. But I just found it interesting that they seem to imply that they're raising some questions that need to be investigated.